So I don't have to walk you through any of this anymore, just to keep in mind the time limits. I have these two signs. 1 more minute. Please conclude. It's really important because otherwise it's impossible to do this in 1 hour. We try our best. So let's just start. Vaughn, are you there? I hand over to you.
I'm here. Okay. So let me know when you're ready to begin and we'll start.
Yes, just I would say just start now. It's 8 o'clock.
Okay, very good. Thank you. Excellencies, distinguished colleagues, and participants. Welcome to this morning session on COVID-19 vaccines, scientific advances, access models, and vaccination acceptance. I'm Vaughn Tarikian. I serve as the Executive Director for Policy and Global Affairs at the U.S. National Academy of Sciences, Engineering, and Medicine, but I also serve as the co-chair of the 10-member group of experts to the Technology Facilitation Mechanism for the Sustainable Development Goals. It is indeed my pleasure to be opening this panel of high-level experts on the issue around COVID-19 and vaccines. In fact, COVID-19 as a pandemic is having tremendous effects on every day of every part of everyday life. Just look at this session over these 2 weeks here at the high-level political forum, an unprecedented step of removing it from the United Nations building in New York and distributing it around the world. In fact, every way that we look at it, COVID-19 is affecting life as we know it. In many ways, the only way that we will move forward from COVID-19 and return to whatever the new normal is has been tied up in the way that vaccines will be developed and distributed. It is for this reason that this session, talking about the scientific advances in vaccines, but also how to access them and the acceptance, and particularly the implications of trust in science, become all the more important if we are to move forward. So it is my great pleasure to now turn over the opening to two distinguished colleagues within the UN system who will have a tremendous perspective on these two issues. Let me first turn the floor over to Mr. Liu Zhemin, who is the United Nations Undersecretary General for Economic and Social Affairs. Undersecretary Zhemin.
Thank you. Thank you all. Good morning, good afternoon, and good evening to all. Excellencies, colleagues, ladies and gentlemen. I'm very pleased to join you at this important side event on COVID-19 vaccines, scientific advances, access models, and vaccination acceptance. Let me thank colleagues and friends from the UN Technology Facilitation Mechanism, World Health Organization, Gavi, the Vaccine Alliance, Wilton Park, U.S. Council for International Peace Foundation, Peace Partners for Sustainable Development, and City University of New York for co-organizing this meeting. I'd like to thank you all for joining us online. There's no topic of greater importance today. The COVID-19 pandemic has uprooted the lives of billions. Many have lost loved ones, and many more continue to suffer from the disease and from the unavoidable consequences of what we must do to slow its spread. Ladies and gentlemen, as scientists around the world tell us, this pandemic will only be over when we have effective and safe vaccines, accessible to all and adopted by sufficiently large number of people. As we work towards this solution, we must recognize that our progress reveals not just advances in capabilities, but also our inequalities and the challenges in mobilizing the whole of society and the whole of humanity response. Recent advances in biotechnology and digital technologies have helped speed up virus identification, testing, drug and vaccine development. This is heartening and gives us hope. At the same time, many institutions are falling short during this unexpected stress test. As the Department of Economic and Social Affairs, the UNDESA, presented in its COVID-19 policy briefs, This crisis is a wake-up call. It is a call for strengthening the science, policy, and society interface at all levels, and for building public trust in science. Indeed, for more effective international cooperation around the science, technology, and innovation. Ladies and gentlemen, in 2015, the UN member states launched the UN Technology Facilitation Mechanism in support of the SDGs. The mechanism, which UN DESA convenes, seeks to encourage a new multi-stakeholder way of working. It aims to bring governmental decision makers, and the entire UN system closer to the private sector, academia, and civil society to more effectively deploy science, technology, and innovation towards the SDGs. The event you are participating in today is in line with this objective. We will continue our collaboration with you to better inform our own broader capacity development efforts. Strengthening the science, policy, and society interface at all levels is critical, including in the recovery for the pandemic. We will also continue to disseminate good practices and promote partnerships in all of the areas where science, technology, and innovation are effective. Our recent call for technology-based responses to the pandemic elicited hundreds of submissions, which we will share through our website. I encourage you all to get engaged, and I wish you all an inspiring and fruitful discussion today. I thank you.
Mr. Undersecretary, thank you for those remarks, and thank you for linking this critical discussion today to the broader sustainable development goals and the processes put in place to try to achieve them within both the UN system and more broadly. I'm now going to turn the floor over to Dr. Mariangela Samal, the Assistant Director General, Access to Medicines and Health Products for the World Health Organization. Dr. Samal.
Thank you very much, and thank you for the opportunity for WHO to say some opening remarks. You may have heard Dr. Tedros, the DDG of WHO, saying that COVID pandemic is the defining health crisis of our time. I certainly hope we won't go through another one this century. But as of yesterday, we had over 1 million cases reported to WHO, 11 million cases, and with over 1 million cases being reported in each of the last 3 weeks. So we are on a fast scaling up of the numbers. And the Americas are, you are seeing it's the hardest hit region currently. And we, as my predecessor just spoke, we know this is much more than a health crisis, because all over the world, lives and livelihoods have been turned into a turmoil. And besides the enormous burden imposed in some countries' health systems due to the need for acute care, we have routine services like antenatal care, immunization for children, cancer diagnostics and treatment, mental health services, which are becoming more and more important in the context we are living in, are seriously disrupted. And the effects of this pandemic in terms of health and inequality are profound, and we may feel it for years to come. Because as usual, those who can least afford it are paying the highest price. And this pandemic has highlighted and exacerbated glaring inequalities within countries and between countries, among countries. WHO was formed more than 70 years ago on the conviction that health is a human right for all people and not a privilege for those who can afford it. And that conviction remains at the heart of everything WHO does. It's why we made universal health coverage our top priority, and why universal health coverage was the subject of a high-level UN General Assembly meeting very recently. We are working in a world in which all people can should access the services they need without having to face financial hardship. And as the pandemic has illustrated, the lack of access to affordable quality health care just not only puts lives at risk, but it also a brake on the socioeconomic development and a threat to global security. As you hear today on this panel, WHO and other partners, Gavi, CEPI, and others who are joining us, we are working tirelessly to ensure timely and equitable access to COVID tools, and vaccines are one of these tools. The COVID pandemic is a public health challenge, an economic challenge, a scientific challenge, and also a political challenge, but not only that. And again, paraphrasing Dr. Tedros, it's also a test of character for all of us, either as individuals or member states or academic institutions, all partners. It's a test of whether we can truly come together in a spirit of solidarity to protect those who are most at risk. And needless to say to this group that we have a shared responsibility to keep each other safe, both locally and globally, because this pandemic is pervasive, it's everywhere, and it requires an all-countries approach, as no country will be free of COVID-19 situations not controlled elsewhere. This means we have a shared responsibility to ensure that as vaccines and therapeutics become available for COVID, they are available for all. Thank you very much, and I wish you all a very productive panel.
Thank you very much, Assistant Director General Samal. Thank you for the broad insights into the many different scales at which this pandemic must be addressed. I'm now going to turn over and end this session, but turn it over to today's moderator, Mr. Alex Roll, the Senior Economic Affairs Officer for UNDESA. Alex.
Thank you, Dr. Torrica, and thank you, Mr. Leo. Thank you, Dr. Samal. Your presence today is really a testament to the importance of our discussions today. You also perfectly set the scene, so let's just dive right in. Thank you all who are on this call. There are more than 200 participants at this point. And you may wonder, who are these participants? They are from all world regions. Roughly 1/4 of them are government officials, many of them very high level from UN missions and line ministries. They represent 33 UN member states, another quarter NGOs. There are UN system and expert bodies, academia and private sector, including some big name pharmaceuticals. I'm humbled by all your presence and apologize that we won't be able to accommodate all your requests for interventions. We would like to do so, and I'm sure there will be opportunities in the future in terms of follow-up discussions. But if you have any burning questions, desires, or want to share some material, please use the chat box during this meeting. Everything you submit will be part of the meeting record. We will write up a proper report afterwards. So in the next 30 minutes, we will try to accomplish the impossible. In 3 short sessions, 6 world-renowned experts will give us an overview from scientific advances in COVID-19 vaccines to access models, vaccination acceptance, and literacy. Scott, Heidi, and Nancy will also launch a specific call for joint action. The second half of today's event will then go into Q&A and statements. So first session, what is the status of scientific advances in these vaccines, and what are implications for policy? Our first speaker is Dr. Melanie Seville. She's Director of Vaccine Research and Development at CEPI, the Coalition for Epidemic Preparedness Innovations. She oversees CEPI-funded vaccines in development. She's a physician and virologist and has worked on development and licensure of several vaccines. Previous engagements were with Public Health England, Sanofi Pasteur, Janssen Vaccines, etc., etc. Melanie, you have the floor.
Alex, thank you very much, and thank you for inviting me to talk a little bit about the scientific advancements in terms of vaccine development against COVID-19. I think obviously we all recognize the impact both on health and the economies of COVID-19, and vaccines are really an exit strategy to the pandemic. So as developing vaccines, I'm sure many of you will know, usually it can take up to decades to develop vaccines for newly emerging infectious diseases. And what the scientific and vaccine development community is trying to do here is move from decades to 12 to 18 months to develop vaccines to prevent COVID-19. With that in mind, how can we do that to go from multiple years to 12 to 18 months? I think it's important to highlight. And in this case, it's really about doing multiple activities in sequence in parallel rather than in sequence. Normally, you stage your investments as you go along the development chain, but here there is no, the one thing you cannot change is ensuring that you test the vaccines, ensure that they are safe and efficacious. But there are a number of things that you can do, taking more financial risk by doing multiple things in parallel. And in this situation, early investment, for example, in manufacturing scale up and scale out is a critical piece to accelerate vaccine development. So as part of CEPI and actually part of working with the ACT Accelerator, working with Gavi and WHO under the vaccine pillar that we call COVAX, we have the objective to develop vaccines and ensure that 2 billion doses of vaccine will be available by the end of 2021. So that is clearly very accelerated vaccine development. And with that in mind, in terms of the R&D and the manufacturing piece, that requires investing in multiple candidates across various different vaccine platforms to advance vaccine development. And there are currently, actually globally, there are over 200 vaccine candidates in development, of which I think the latest count is at least 18 of those candidates have already entered clinical testing just 6 months after the sequence was isolated. And there are the first candidates now really entering advanced development and efficacy trials. So this is really unprecedented. In terms of being successful in vaccine development, I think there are 3 key parameters to consider. The first being the speed. So we have seen that there are a number of different types of vaccines, the mRNA type vaccines, viral vectors, recombinant proteins that can be advanced quite quickly into the clinic. The second piece is scale. So to get to the ambition of 2 billion doses by the end of 2021, we need vaccine candidates that have the capacity to produce hundreds of millions, if not billions, of doses of vaccine. So it is very important that the candidates that are looking promising and are scalable are advanced. And then the third piece, which will be discussed in more detail, obviously, is the access component, ensuring that there is global access to the vaccine for the most vulnerable populations, understanding that when vaccine will be first available, that it will be in short supply, and we need to make sure that the most vulnerable populations have access to the vaccines first, irrespective of where they are globally. So specifically, a little bit about the ACT Accelerator and the vaccine pillar COVAX. So we currently have 9 vaccines in development, funded under the COVAX pillar, initially under CEPI, but now under COVAX. And we are planning to expand that portfolio in order to meet the expectation of billions of doses by the end of 2021. Within that portfolio, 6 of the 9 are already in the clinic, so making a significant contribution to the global vaccine efforts. And we are working very closely with our other partners, namely Gavi and WHO, to ensure that it actually have a seamless end-to-end approach to vaccine development through delivery with a fair allocation. So with this approach, we're already involving Gavi and WHO at a very early stage in terms of vaccine development to ensure that everything can be prepared for delivery. I think the one last thing to say, though, is vaccine development is a very risky business. We do not we know that all candidates will not be successful. It's a complex business, so having a broad portfolio and learning as we go along is really going to be critical to advance these candidates to a licensure and to large-scale use. So thank you very much.
Thank you very much, Melanie. It is certainly heartening to hear that the rush to develop and deploy COVID-19 vaccines will not come at the health and safety risk of individuals, but rather as primarily a financial risk. You also answered some of the burning questions that people submitted online before this meeting, many of them from India all the way to Australia. When will COVID-19 vaccines be available internationally? So now we know 2 billion doses by the end of 2021. And I also want to congratulate CEPI for what they've done. I would say they saved the world months, if not years, in vaccine development, and that translates, of course, in many thousands of lives saved. So let me hand over to Dr. Soumya Swaminathan. Sorry for the pronunciation. I tried hard. She's an equally eminent speaker. She's chief scientist of the World Health Organization, originally a pediatrician from India. She's also a world-renowned researcher on tuberculosis and HIV, a member of various academies of sciences, former director general of the Indian Council of Medical Research, again, etc., etc. I don't have the time to give all the credit to you. Suma, you have the floor. It's a great pleasure to have you here.
Thank you so much, Alex, and also for summing up so beautifully what Melanie has explained. And as she said, WHO, CEPI, and Gavi are working very, very closely together. And I think what I see is that one of the big, successes of the ACT Accelerator, which was only launched on the 24th of April, so it's only been about 8 weeks. But even within that short period of time, we can see how these different agencies coming together and working on a common goal and bringing the strengths of each of these organizations to bear on the problem has already resulted in us really, I think, making a lot of progress. Now, ultimately, whether we get a successful vaccine, how many vaccines we get, all of that are still unknowns, and we have to wait for the results of the clinical trials. But we can be cautiously optimistic that because of the huge amount of science behind this and amount of R&D that's being invested all over the world and the variety of different platforms that are being tested, that there should be some success. But we are yet understanding the immunology of the disease. We're still understanding what protective immunity means. As you know, for some diseases like TB and HIV and malaria, we still don't have successful vaccines because the immune responses are very complex and difficult to elicit with a vaccine. However, we're more hopeful that the coronavirus, which is a much simpler organism, it's a single-stranded RNA virus, and therefore it should be possible to get a vaccine that creates antibodies and immunity against the antigens of this. Now, as far as the other aspects of vaccines, one is, of course, the R&D aspects that get all the attention. We see all the big media announcements coming from the companies about potential successes and so on. But there's also a whole lot of other things that need to be done on the policy, the regulatory side, and also on the preparations within countries. So this is where we have our groups like the SAGE, the Scientific Advisory Group on immunizations, which is the policy-making body for the world for vaccines. They have set up a working group now to look at COVID vaccines, to try to understand what the landscape looks like, and also try and analyze how these vaccines would be deployed or should be deployed in a population. We are very sure that at the beginning, in 2021 and possibly through 2022, we will have limited supplies of vaccines. Even if we get success in the clinical trials, we are not going to have the billions of doses that are going to be needed. So how are we going to distribute and allocate in a fair and equitable way the limited supply of vaccines? And Melanie mentioned our goal is to have at least 2 billion doses of the vaccine available by the end of 2021. But it may start earlier in the year, but with smaller doses. And this is where WHO has been working, and Dr. Samal, who spoke earlier, has been leading the work on the fair allocation of vaccines. We've had too many instances in the past in the world where there's been a lot of inequity, starting with traditional vaccines like hepatitis B vaccine that actually took 30 years before low-income countries had access to a vaccine which high-income countries had access long ago. And it wasn't that it was difficult to produce or that it was not affordable, but it just did not happen. We saw again during the 2009 influenza pandemic that the vaccine that was produced by several companies was all pre-booked by high-income countries. And therefore, there were very few doses left over for the rest of the world. Now, luckily for us, that pandemic turned out to be milder than what it could have been. And if it had actually been a severe flu pandemic, it would have had a very, very poor consequences for a large part of the world. So we do not want a situation where next year we have some countries that were able to pre-secure vaccines, able to vaccinate their populations, while large parts of the world go without. So we're trying to develop an allocation framework and an allocation mechanism that will work hand in hand with the COVAX facility that Gavi is setting up. And the idea of the COVAX facility is to get countries to pool their resources into this facility, especially those that are going to be self-purchasing their vaccines, so that you have enough of a pool of money that you could actually go in and invest in a large number of vaccine candidates to increase the chances of success, but also to make sure that there is enough of a pool of vaccines available, of doses available, to do fair distribution. And the way in which we are thinking, and of course this is being co-developed and evolved with consultation with member states, that every 2 weeks we update our member states on where we are, they provide feedback. And the way that it's shaping up currently is to say the first tranche of vaccines would go to cover the highest risk people, who are the frontline workers and the healthcare workers. That's about, every country would get about to cover enough of 3% of their population. The next tranche would go up to 20% of the country's population in order to cover the rest of the vulnerable groups, whether they're the elderly or whether they're the people with other diseases and so on. And then within a year or two, hopefully there'll be enough doses for their young adult population to also be vaccinated, so that you're completely then looking at ramping down the pandemic. But at least the first 20% of the population will help to save lives, will help to try and reopen economies, and will bring at least an end to the acute phase of the pandemic. So that is the goal right now. But for this to be successful, it needs a buy-in from all countries. It needs especially the upper income and the upper middle income and high income countries to agree to this mechanism, this COVAX facility, and it's open currently for expressions of interest. In fact, today is the deadline, but I think it will be open for a couple of days. And by the end of August, we expect that those self-financing countries will actually put in some financial commitments into this pooling mechanism. And finally, WHO works with regulators around the world to ensure that there's some harmonization of what regulators will expect to see in a vaccine before it's licensed. So that is important, because we do not want necessarily a vaccine with very low efficacy or with safety issues to be licensed in some parts of the world. And so sort of harmonization and a regulatory approach to licensing or to emergency use, for that matter, would be extremely helpful. So I think I will stop there, and we can see if there are questions later. Over to you, Alex. Thank you.
Thank you, Soumya. Indeed, very exciting to hear the latest on the COVAX facility and all the other WHO activities. Then underline the importance of international cooperation in this regard. You also answered quite a few of the questions we received before the meeting, especially relating to equitable distribution. How would this work out, the allocation mechanism, and so on. There's just one question that was highlighted here was, will these vaccines be effective for all strains of COVID-19? maybe you can just quickly answer the question and we move on to the next session.
Very quickly, as far as we know now, yes, the mutations in the virus, and it's natural for all viruses to have mutations and to evolve as time goes on. But so far, there hasn't been any mutation in the key protein area of the spike protein of the virus, which indicates that a vaccine may not be effective. But of course, this needs to be constantly monitored. We know in flu, for example, you need to change the strain every year. But so far, that's not the case with the SARS-CoV-2, and let's hope it stays that way. Over.
Thank you. With these optimistic words, let's move to the next session. So we also need access models to these vaccines. We need to manufacture, deploy them, equitably distribute them. So one of the most important global players in this regard is, of course, Gavi, the Vaccine Alliance. It is our great pleasure, therefore, to have today with us Mrs. Aurelia Nguyen. Again, I'm sorry for the pronunciation, who is the Managing Director of Vaccines and Sustainability at Gavi. Aurelia works to turn Gavi's resources into impactful and financially sustainable vaccine programs and markets. All this to support equitable uptake of vaccines. Previously, Aurelia also held posts at GlaxoSmithKline on access of medicines and vaccines in developing countries. Aurelia, we're excited to hear from you. You have the floor.
Thank you very much, Alex, and thank you very much for the opportunity to join the discussion today. With the same point that's been highlighted around how the vaccine perspective for COVID-19 is going to be a critical one in terms of stopping transmission and getting the world on a path where social and economic recovery take place. And if we are going to make vaccines, particularly for priority populations in record time and being able to do so globally, we're going to need innovative approaches. Melanie talked to this in terms of the timing that we're trying to compress for the development pathway, and also that it needs to be linked with at-risk investments for the steps like the manufacturing and delivery. The fact that we don't have globally agreed frameworks or models for access to vaccines against pandemics that are not influenza means that it is quite an unprecedented challenge, and we are really mobilizing an unprecedented collaboration. So, of course, not least with my colleagues and counterparts at WHO, Sumia, Mariangela, and Mel, but much more widely beyond. We're going to be facing some challenges in terms of equitable global access without having a mechanism in place so that we can incorporate, on the one side, robust country commitments to finance the demand, and on the other, the commitment from industry. The developers and manufacturers may not scale up manufacturing early enough. They may not be able to coordinate or optimize a good vaccine output, and that would mean having insufficient global production capacity to meet the global needs. The countries may not work in solidarity in terms of prioritizing and allocating what's going to be, as was mentioned, a very limited supply, and one that where we need the supply to be aligned to the global public health needs. And then we also need to be cognizant of a context of significant risk of political instability and social unrest if the vaccine is not available to large portions of the world's population, and it's perceived as being reserved for only select and privileged segments of populations. So we need models of coordination that build on the unique experience and the comparative strengths that have been acquired by a number of institutions. So as was mentioned before, the ACT accelerator and particularly the vaccine pillar, COVAX as we call it, is really the key item here, where we have, on the one hand, the depth of expertise brought to bear by CEPI from an R&D perspective, looking at the manufacturing scale-up, doing the investments for the most promising candidates, and on the other hand, the WHO perspective in terms of being able to put together a globally agreed framework for allocation. And so from a Gavi perspective, what we've looked at is how to draw on the expertise that we have built in market shaping, in innovative financing tools, and in working with countries to support the rollout of new vaccine programs. The Gavi Alliance as a whole, having provided billions of dollars in financing for vaccine scale-up and delivering vaccines to 50% of the world's children. So we've envisaged these efforts within an innovative financing mechanism in which integrates the multi-partner efforts and is able to coalesce through the ACT partnership. This has led to the launch of a facility, which Soumya alluded to, and I'll describe in more detail. The COVAX facility, the full name COVID-19 Vaccine Global Access Facility, COVAX facility for short. The primary objective of the facility is to accelerate equitable access to appropriate, safe, and efficacious vaccines. Equity means that not only are doses fairly allocated to the right population, but that all allocation is also timely. The facility is aiming to secure supply rapidly through the scale-up of manufacturing with the manufacturing partners. So three design principles have been important here, or rather I should call them operating principles. One is global access, so protecting global health security in order to ensure that everyone can secure access to a safe and efficacious vaccine. The second is to have a view that's impact-oriented and transparent, to be very single-minded in the goal of ensuring equitable access to a COVID-19 vaccine and to support a coordinated strategy for vaccination. And the third is around solidarity and collective ownership. Countries can work together to overcome this pandemic, and achieving a collaborative effort will take political and financial commitments. So at the core of the COVAX facility is a risk management mechanism. It's about providing an insurance policy to all governments and contributing to the global scale of vaccines. So what this does is it provides governments with the opportunity to access a larger portfolio of COVID-19 candidate vaccines. We do not yet know which will be the successful vaccines, and so this portfolio helps to have access to a range of technologies. It's a range of manufacturers that are diverse and geographically spread, and a bigger market to provide security of demand than the governments or any regional groups can support on their own. And even where governments are already accessing candidates bilaterally with manufacturers, it acts as an insurance policy by expanding and diversifying the portfolio of available candidates. A part of the facility is what we are calling the Gavi COVAX AMC, or Advanced Market Commitment. And this part of it is around providing funding for vaccines for developing countries to be able to create the scale and to have an incentive structure for manufacturers for low and lower middle income countries. And the facility is very much designed to be flexible for a number of different demand scenarios, and allows for the risk to be shared along with the benefits as a successful vaccine is developed. And it helps increase the likelihood of there being enough doses for everyone to have access to as soon as a vaccine is licensed. So countries can participate in the facility either as self-financing countries or as donor-supported countries through ODA. Both groups of countries will begin to receive doses at the same time to enable them to vaccinate their highest risk populations as soon as supply becomes available to the facility. So we invite countries to to submit their expressions of interest, and we look forward to engaging more. Thank you very much.
Thank you very much indeed, Aurelia. There's so much to be said about the initiatives and actions of Gavi. We need a whole separate meeting on this one. You also answered many of the questions. I'm sure I can't name all these questions now because we don't have the time. We run out of time. But thank you very much. Let's move on to the next session. Once developed and deployed, there's still a growing issue of public trust in science in general and vaccines in particular. How can this trust be earned, vaccine literacy be built, and misleading vaccine information and vaccine hesitancy be addressed? It's our great pleasure to have a trio of academic heavyweights, Dr. Scott Dredson, Professor Heidi Larson, and Mrs. Nancy Lee, and they will give a joint presentation on these very intricate issues. Heidi is a professor of anthropology, risk and decision science at the London School of Hygiene and Tropical Medicine, director of Vaccine Confidence Project, clinical professor, University of Washington, and on and on. I don't have time, I'm very sorry, but Scott is a distinguished lecturer at City University of New York. He is executive director of Business Partners for Sustainable Development, many academic appointments at Harvard Kennedy School, Columbia, Tufts, George Washington, on and on. Maybe you've seen his book, The Mad Cow Crisis, which I found fascinating. Nancy, the third one in the trio, is Program Director of Global Health at Wilton Park, which is an executive agency of the UK Foreign and Commonwealth Office. She previously also served as Global Policy Lead for the Wellcome Trust. Again, on and on. What a distinguished group of presenters. Please, you have the floor. I believe Heidi will start.
Yes.
Hi, thanks very much. I appreciate that we're running out of time here, so I'll be concise. I just wanted to say trust is at the center of our initiative for building confidence and trust in vaccines, particularly the COVID vaccine between CUNY, SHTM, and Wilton Park with a broad group of stakeholders, which Scott will talk more about, and Nancy. But I just wanted to give the framing of saying that we have work to do, not just about confidence in the vaccine, but we have quite a few people in different parts of the world who do not believe COVID exists. And we will never gain confidence in a vaccine if people don't believe they need it. So the good news is that we have time, as you heard, a minimum of a year to 18 months to get it as
Did we lose Heidi?
Looks like we lost Heidi. Can anyone jump in?
Alice, this is Scott. Then I will, while she gets back on, we can move to the next slides that I think we're illustrating what she was saying. This is what we were going to speak about. The next one, please. What Heidi was basically reminding, and the Vaccine Confidence Project at the London School has been following this for years, but you can see that not only was the movement well established in regards to vaccines in general, but reinvigorated with a new vaccine information war and the infodemic that's been called by the WHO and others, that shows that we even have more people that are apt to refuse a vaccine, or not only refuse it, but actually campaign against it. And this slide illustrates that in a scary way, if I can say. If we can move to the next one, what Heidi also was saying was that we need to understand that some people don't believe this even exists, notwithstanding certain country leaders saying it was a hoax and it was something that was not going to happen. We have an incredible social media confluence around the world that is building up in a problematic way. And Heidi wanted to share this one, as you see most recently in the Independent published in the United Kingdom. If we go to the next one, please. This also shows this is not only in the North, Global South, and around the world, that this is another snapshot just in the last few days so we could see what's happening. In this case, I think the pictures speak for themselves. But unfortunately, whilst we lost Heidi on this discussion, she's been actively engaged in what she referred to as the last two Wilton Park meetings. And I would suggest everyone looks back at their invitation. There's a second connected piece on that's attached. It's the new initiative, Convince, that we like to speak about. And if Heidi is back on, I don't know if she has anything else that she'd like to say. And while you were offline, Heidi, I went through your last two slides.
I'm not sure when I went offline. Anyway, you could pick up on it.
Okay. So with this in mind, in the interest of time, if we could go to the next slide, and I'll talk a little bit more about a study that we've done as part of our activities with the City University of New York and also with the support of the U.S. Council for International Business. We wanted to gauge how likely people would to take the vaccine. And Heidi can speak more about the work that's been done over the years. The Vaccine Confidence Project is mentioned earlier, but our numbers corroborate, whilst these haven't been published yet and they're still being validated, we thought it was important to share that we have a dearth of interest and likelihood to get to the level of whether you want to call it herd immunity or community immunity with a COVID vaccine. And if you look at this from the right, being Russia, Poland, France below 60%, to the left, China, Brazil, Korea, in the 80s, we have some work to do. And whilst we've heard about having 2 billion doses and the equitable distribution and all the other issues, if people do not take this vaccine, it will not get us back to the exit strategy that was heralded earlier in this discussion by the WHO. We have one other survey that we've done which speaks to why we believe we need to work better together. And if we go to the next slide, please, you can see here that the business and community are amongst the most trusted source of information to get us, one, back economically, but also people follow their employers for getting vaccines or other areas. And what you can see here on the health, preventive behavior, and other aspects of what are necessary is that there's a gap that we believe, by looking at these numbers again, that mostly in the middle, fewer than half of countries, general population believes that people are working together. So we believe this is an upside opportunity for us. And then let me just make one statement when we go to the next slide, and I'll turn it over to Nancy and Heidi back, is that we've chosen this term vaccine literacy. And as Heidi well said, people need to have information, knowledge of, one, that COVID exists and it's real, two, what goes into a vaccine and some basic knowledge on health and health literacy. But the vaccine literacy are not just for the general population, it's for the policymakers, the public health officials, and others that have to help galvanize at different levels. And we've had this discussion, we've come up with Convince. I'll turn it over to Nancy, but mention why those two logos are there is the U.S. Council for International Business and Business Partners for Sustainable Development already have agreed to begin to serve it as a hub for the private sector to engage in this. And we believe with others who are on this call, I want to thank UNDESA for this organization, can very much engage in a meaningful way. And I'll turn it over to Nancy, as we've had over 100 people on a couple of occasions engaged to help support this idea and this initiative that we're just beginning, hopefully, with the call to action today. And so I'll turn it back over to Nancy, and then Heidi, if there's anything else you'd like to add.
Great. Thanks very much, Scott. And in the interest of time, I'll keep this short. So we've heard a bit about the qualitative and the quantitative case for why we need a collective effort to inform and engage and communicate with publics everywhere about the new COVID vaccine. Huge efforts from CEPI, WHO, Gavi, governments and researchers globally will be wasted if vaccines aren't taken up by populations everywhere because they choose not to for various reasons. So we're creating a coalition which will start at the far end of the spectrum from what Melanie has talked about. So CEPI, Gavi and others looking at the development of vaccines and Convince COVID-19 New Vaccine Information, Communication and Education, a coalition at the far end to ensure that populations and publics around the world take up vaccines. So our call is for communities everywhere to join this. Is a whole of society approach. What we aim to do is support multi-sectoral commitment to develop trust in vaccines through the preparation of accurate and convincing information sources about vaccines, through innovative multimedia and interpersonal approaches to communicate and engage with audiences everywhere. So I'll leave it at that in the interest of time, and you've got the call to action in your packet.
Well, thank you again, Heidi, Scott, and Nancy. I believe you made a really convincing case with your call for action. I'm sure many of those who are listening here will consider trying to get engaged and then possibly joining forces on this. You will definitely be in touch regarding your pertinent ideas. Now let's give a round of applause to all our 6 experts. And move into the statement, questions and answers session. We're running a bit late, as all of you know, but we try our best here. Let's try to keep statements short. If you can do in 1 minute or less, it will be great.
1 minute.
I think I have online so far Gadelia, Michiharu Nakamura, Jose Ramon Lopez Portillo, and Sadwakas. If I missed someone on our list, please write us a message in the chat box. And Ambassador Thompson, you're not there, are you? Ambassador Sarufa, you're not there? Okay, so let's start with Paulo. Dr. Paulo Gadelha, a long-time member of 10-member group and former president of Fiocruz. You have the floor. We're very interested in your experience.
Okay, thanks, Alex. Yes, we do have a great opportunity to strengthen public trust in science and vaccine acceptance. But this comes also with the high risks. First of all, we should be careful of not overselling the prospects of short-term vaccines as magic bullets, which may lead to frustration and distrust. In a sense, the lesser success of COVID-19 vaccines and the guarantee of their universal and equitable access are the only conditions to change prior tendencies of distrust and rebuild vaccine coverage. This was very much stressed by Sumia and now by the ones that address the question of public trust. In terms of public trust, the question of COVID and vaccine literacy should be thought in a broader sense in terms of citizen science, which is one of the major proposals of TFM. But on the other hand, considering the complexity of SARS-CoV-2 humoral and cellular immune response and possible weak points of existing advanced vaccines, it is essential to maintain a strong support of R&D in order to achieve feasible mass production of more effective and friendly vaccines in terms of immunization calendar. Sumia also addressed this, and Mariangela. Also, there will be no global production capacity without fostering regional and local production. This should be coupled whenever viable with tech transfer to assure the development and consolidation of local systems of innovation and strengthen sovereignty of countries and regions to support their health needs. In the long term, vaccine delivery should be incorporated to national programs of immunization with free access to relevant public health challenges. And in this sense, Brazil, with its national immunization program, is a case of success. Just to end my presentation and in the comments, all these comments are very much aligned with the vision of the 2030 Agenda, the proposal of TFM, IATT, and the 10-member group. Reduce global asymmetry, strengthen national capacities for science-based decision-making across all countries, share knowledge and data to promote collaborative research and innovation, ensure universal access to solutions. Most important of all, to harness STI to SDGs and to leave no one behind. Thank you.
Thank you, Paolo. This is indeed very, very pertinent. You brought us back to reality. I believe it's really important, strong support for R&D, citizen science as an approach. Thank you for sharing this and outlining almost an action plan for all of us. Now let me turn over to Nakamura-san, another member of the TFM 10-member group and currently counselor to the President of Japan Science and Technology Agency. Nakamura-san, are you there? Are you online? Okay. I give you another minute, so let me turn over to Jose Ramon Lopez Portillo. Yes, another very important member of the TFM 10-member group.
Thank you very much, Alex, and thank you to DESA. Well, I believe that access to health is a human right, and COVID-19 is or represents an existential risk now and in the future, as well as other viruses like this one. So my question is, will the vaccine and should the vaccine against the COVID be a public good? And if not, why have the risks of developing it have been socialized? So many countries and the governments are paying for this, but the benefits are private. And the delivery to all dependent on this vaccine will be just related to this fact. I believe that under present circumstances, market incentives are not really working, and we must make sure that we can all share the risk of developing, producing, distributing, and giving the vaccine to precisely the vulnerable population. As things are, many countries, for example, my country, Mexico, might even reach herd immunity by the time it is distributed. And many people are not going to be available for the vaccine. So my question is really, should we propose strongly that this becomes and is considered a public good and not a private asset? Because this is extreme circumstances. This is an existential risk for the present and future of humanity.
Thank you, Jose Ramon. Yeah, should this be a global public good? A question to all the panelists for their final response in the end. So let me see. We have on our list here, Nakamura-san, are you on now?
Yes. Thank you, Alex. You hear me? It is great to hear the very encouraging update of vaccine development and associated activities. I believe that it is important that the vaccine development functions as a pipeline in which the best technologies remain in the era with COVID-19. It is expected that each country strongly supports vaccine development through public-private partnerships and enhances cooperation with WHO, CEPI, Gavi, and other relevant organizations. Social acceptance of vaccine and vaccination and vaccine literacy based on trust in science are emerging global challenges. While it is important to always handle the result of science and technology with maximum care, it's also necessary to increase societal awareness of those results through active scientific communication, in particular for the early resolution of the COVID-19 pandemic. We appreciate that WHO, as well as the science community and the vaccine developers, play a role in improving global vaccine literacy. For urgent development of COVID-19 vaccine, researchers around the world are encouraged to share reliable data among them. In this sense, the degradation proposed by Dr. Jeremy Farrar of the Wellcome Trust, sharing research data and findings relevant to the novel coronavirus outbreak. is extremely important for promoting data sharing among researchers and providing WHO with quick access to the data. I hope that UN technology facilitation mechanism for SDR for SDGs support such open science as a new paradigm of science. Thank you. Over to you, Alex.
Thank you, Nakamura-san. Indeed, you're also outlining a lot of work ahead for us in the TFM. Thank you for your engagement as we count on you. You've seen in the chat box a message from IFRC, and I would just want to see whether Richard Blewett is online now and would like to make a short statement on community engagement on the ground, that, as we just heard, is very important. Are you there, Richard? No, okay, let's, in the interest of time, let's move on to Mr. Saad Wakas. He's the coordinator of COVID-19 campaign in the International Federation of Medical Students Associations. We're very interested to hear from you. You have the floor.
Thank you very much, Alex. And yeah, I would like to start with a short anecdote of the scientist that went to a remote village wanting to introduce electricity there, and how the villagers kicked the scientists out, saying that this was the work of the devil. And I believe this anecdote really resonates with what's happening with vaccination hesitancy today, because we tend to, most of the time, communicate with not the same language as the people that we're trying to reach out to. And this is where the anti-vax campaign is winning us, using the fear language, using the emotional language, and this is something we need here. So from the inside of IFMSA, I would like to share some best practices, lessons learned from the work of different international or national medical students on the ground on spreading vaccination and fighting vaccination hesitancy. So starting with universal vaccination access, we have learned that engaging health professionals is a must. And here we talked about capacity building of health students, especially focusing on medical students, also midwives and nursing, because those tend to be the ones with relation and contact and interaction with patients. So engaging them and building their capacity in vaccination is a very important thing. Secondly, we must focus on innovation. Innovation when it comes to vaccination delivery can be really a good asset for us to empower or you have more universal vaccination access. And third and finally, which is focused on vulnerable groups. And those tend to be the ones with more mistrust levels. So we talked about refugees, we talked about LGBTQ communities, migrants, etc. So having community engagement, having leaders and representatives of those groups in our side and transforming them from targets to actors will allow us to reach out to those groups and have access to vaccines. So this is when it comes to access. Now I would like to briefly talk about vaccination hesitancy and what we've been doing, and also what lessons we've learned regarding that. So first thing when it comes to hesitancy is engaging media and decision makers. And again, when it comes to the war against hesitancy, those are very essential stakeholders to get in our side, and those can also use the emotional language to engage people and communicate the pro-vax messages. So making sure to engage media on the national level as well as stakeholders. The second is again engaging the health workers themselves as seeing their close contacts with the population. Also focusing on education itself, focusing on youth, focusing on schools, focusing on spreading the vaccination messages since the primary schools, and reaching out to the kids is a necessity. So that's something to focus on as well. And when it comes to combating vaccination hesitancy and all the myths and info or disinfo that's spreading, there is an interesting conference or event being held by the WHO, which is the Infodemiology Conference, being held this week. And I guess the 21st of the 21st of July, there will be the wrap-up webinar. So there will be some interesting messages there on how to analyze the actors of acting on disinformation, what are their benefits, what are the different channels used. So those are some reflections there. So as a final message, I would also say that capacity building of health actors and health workers and engaging different community leaders to reach out to grassroots communities is a must. So it's a battle which has to be multidisciplinary. And yeah, this is my input, and thanks for giving me the floor.
Thank you very much. So it's 9:04 now, so we run over time already, and some people will be leaving. I would love to give more people the floor, especially I foresee, I hope you will continue to be engaged. But I think we better start concluding because the official session of the HOPF has just started, and some people want to move on to this. I promise we will follow up on this. So there were many questions submitted online, and many of them have been answered. Also, the last statement, given a glimpse of what young people could do in civil society to play a role in this, and in particular in improving vaccine acceptance. This was one key point here. We've heard on ways and means to prioritize access to the vaccines, what has to be changed now, what actions are needed. There were many questions. We will share them with all of you in the meeting documentation. You will be surprised. There's statements from questions from students, from high-level people in intergovernmental organizations and governments. I have a scientific director of big-name pharmaceuticals, young people organized. So you can see, if all these parts of the community will work together, we might make a difference in terms of the COVID-19 vaccine in the future. So let me just turn over to the remaining 5 experts that were online. If you want any very quick last words, 30-second pitch. Can I call Melanie? Melanie, do you want to say a last few words? No. Soumya. Okay. Aurelia. Any last few words?
Sure. Thank you very much, Alex. And again, thank you for putting together this session. I think there is a very strong theme here around the collaboration that's required, and perhaps to the question about whether the COVID-19 vaccine should be a global public good. I think it's important to recognize that all of the stakeholders here have something to bring to the table, and that the innovation that we need comes from the private sector, and the private sector is working at pace, but also needs risk sharing to be done, and we should really build on the existing mechanisms and the stakeholders to be able to bring the vaccine successfully to all of those who need it. So I think the philosophy of the global public good is the right one. I think no one is safe until everyone who needs the vaccine has it, and we need to be able to collaborate on it on a financial basis, and also on the delivery piece, recognizing the constraints and the financial incentives of all the stakeholders in the system. Thank you.
Thank you. This sounds like very good last words already, but Scott, you want to say a few words?
Thank you all. I would echo what's been said, the idea of trust being fundamental and the need for multi-sectoral engagement. We're all in this together, and we need, as Saad and others have said, to think about everyone in society, and ways to communicate with them are not all the same, and frankly, they're not all science-based. We need emotion, we need to build trust, and we need to build back better together. And I think we can do that with vaccine literacy, and Convince Initiative will hopefully contribute in a meaningful way with everyone's engagement.
Thank you so much. I don't see anyone else here online anymore. The new session has started. So let me just hand over to Shantanu for a closing few words.
Thank you, Alex, and a big thanks, first of all, to all of our speakers and participants.
It's busy times for everybody, so we really appreciate your being here and for contributing to this tremendous sharing of knowledge, which has alerted us to what could be expected, but also where the pitfalls and risks are. And I think most importantly, how we can all contribute, whether we work within our individual areas of expertise or across them in shared solidarity to meet this end. Here at UNDESA, you've heard a little bit about our work during this meeting if you were not familiar with it already, but we work at the intersections of science and policymaking and societal response to try and remove some of the frictions that can arise at this interface and promote really the most effective way in which science, technology, and innovation can improve human well-being and reach the SDGs. Now, this clearly, as we have seen, is a conversation from today that will need to be continued over time, not just because of the urgency and immediacy of the issues, but also because it's constantly evolving. And you can count on us to do that and to also work with you on several of the incentives where our own position and expertise may be of help. We will follow up with you on this later. Finally, in conclusion, I would just like to say that it's not like we haven't eradicated a disease through vaccination before. That was smallpox for those of you old enough to actually remember it. But we must also keep in mind that some of the other global diseases like polio and measles, for which we do have vaccines, we've still not managed to eradicate them. And I think we've heard from speakers on where some of these pitfalls are. Fortunately, our knowledge about what works and how to align incentives among various actors has also grown over time. And I'm sure that over the next few months and hopefully not too long a period, we will be able to marshal all of this together to work towards removing the scourge of COVID-19 and being in the process also better prepared with longer term instruments and means and mechanisms to advance human well-being and sustainable development for all. Thank you so much. Alex, this is over to you now to close.
Yeah, we've gone way over time, but I don't want to spoil these great words for what I found a very inspiring and useful side event. I hope this will have a follow-up, and we'll be in touch with you. You can be engaged with us. You will get a full, complete meeting report from us, and hope you will still be engaged. Enjoy the rest of the HOPF. Listen to some of the sessions. And stay engaged. Thank you very much. With this, we close the meeting.